Hi everyone, we are the Allegheny County Combating Overdoses in Rural Areas team. My name is Amila Fatima and I'm our team leader. A fun fact about me is that I actually grew up and went to high school in Allegheny County and graduated from Allegheny High School in 2018. So this is a community that is near and dear to my heart, and I'm really excited for us to present to you all today.
Hi everyone, I'm Cecilia. I'm a member of the Allegheny County team. And today I'm going to go over the learning objectives for our presentation. So today we're going to gain an understanding of what opioids are, determine and assess risk factors for opioid and substance abuse, understand risk factors specific to rural areas like Allegheny County, observe the link between opioid use and mental health issues, develop an understanding of barriers to treatment, learn about resources for prevention and treatment of substance use disorders, and discuss ways to address opioid and substance abuse in Allegheny County.
Hi, I'm Hope, and I'm going to run us through today's agenda for the presentation. So we're going to start with just some background on opioids and opioid addiction, and then we'll talk about what opioids are and the effects of them. And then we'll move into risk factors for opioid abuse, and then talk about the connection between opioid use and mental health. And then we'll talk about some things more specific to Allegheny County, such as barriers to treatment there, and then some local resources.
Hi all, my name is Eden, and we're going to dive right in with a shocking stat, which is that over 81,000 overdose-related deaths between May 2019 to 2020, with an increase of 5,000 at the start of the COVID pandemic, have occurred in the US. To put that into perspective for y'all, Cumberland is about this population of 20,000. So over 4 Cumberlands have died between 2019 and 2020 related to overdose deaths. When we look at specifically Maryland and Allegheny County, we can see from drug and alcohol intoxication deaths from January to March in 2020 for 645, and 2021 it's 682. Now, when we compare stats such as to the graphic on the right, which is unintentional drug and alcohol related deaths in 2019, we see that throughout the year, this value can go over thousands up to 2000s related to opioids. When we look specifically in Allegheny County, from January to March in 2020, we see 13, and in 2021, there we see 9. So this is an improvement, but it also means that we still have work to do. Now, when we relate specifically to adolescence and substance abuse, we see, according to NIH, that 14.6 report abusing prescription drugs, particularly opioid pain relievers. Among those 12 and older in 2019, 50,000 have initiated heroin use within that year. In 2019, 15% of adolescents report to improperly use prescription pain medicine, such as oxytocin. And when we compare that to a similar statistic in Allegheny County, 13.4 in 2018% of high school students reported have taken it incorrectly.
All right, so before getting into this discussion of adolescent substance abuse, let's first just stop to talk about what opioids actually are. So these are a class of drugs that are prescribed to relieve pain. You may have heard of or even been prescribed some of these medications under names like hydrocodone, oxycodone, morphine, and a few others listed on the screen. Opioids originate from the opium poppy plant, which is pictured on the right. And opioids are the most common cause of overdoses in Maryland. So this discussion of opioid overdoses and addiction is especially important and relevant to all of us here.
Hi everyone, I'm Sanjit, and I'm going to go through the examples of opioids that are listed right here. So one major example are prescription opioids, which are typically medically prescribed to treat pain, as Hope was saying, oxycodone, hydrocodone medications such as those. There's also fentanyl, which is a synthetic opioid that is used to treat severe pain, but is often illegally made and misused. Some example uses of medical uses for fentanyl include late-stage cancer, and it is also commonly used in horse tranquilizers. And there's also heroin, which is another example, and this is an illegal substance manufactured from morphine, which, as Hope said earlier, this is an example of an opioid. So all of these substances are extremely dangerous and can cause major harm if used incorrectly. Some symptoms of an opioid overdose include vomiting and gurgling noises. The face is pale and clammy when touched. The body is limp. The lips and fingernails have a blue and purple color. The breathing and heartbeat are very shallow, or they cannot be awakened or are not able to speak. All of these symptoms not all of these symptoms may show up, but it's important to be able to recognize these in order to respond accordingly. So how do we respond to an opioid overdose? That is a quite in-depth topic, but we'll go over the general steps. The 5 general steps are to step 1, rouse and stimulate. Step 2, call 911. Step 3, give naloxone. Step 4, further resuscitation. And step 5, care for the person. These are general steps that, and this is the common trend. So depending on the situation, you may go from, say, step 3 to step 1. It's not exactly linear, but this is a general trend, and you should try to follow these steps in a situation such as those.
Hey everyone, I'm Josh, and I'll be talking about risk factors for opioid abuse. And the first risk factor I'll be discussing is using gateway drugs. And gateway drugs are drugs that may increase the likelihood of opioid use in the future. Exposure and use of these drugs is common in adolescents due to peer pressure and mental health issues. Gateway drugs can be legal and easily attained, so young adults usually feel safer taking them at first instead of going directly to opioids. And young adults are vulnerable to the addictive substances in these drugs due to their developing brains. And some common gateway drugs that you've probably heard of include alcohol, marijuana, and nicotine.
Hi, everyone. My name is Amin, and I'll be running through some more risk factors. So first off, just to briefly give a background on risk factors. These are factors that can predispose you or increase the risk of you obtaining a certain outcome or condition. In our case, that's opioid abuse or opioid addiction and dependence. So the first one is the use of intravenous injections. So the medium through which you elect to choose or you elect to administer your medicine can make a difference. So either taking through pills or using injections. And here using injections can actually be a risk factor for long-term opioid abuse, since heroin, cocaine, and other substances that contain morphine are injected intravenously. And this can extend to even prescription opioids when they're administered intravenously, because these tend to be at high dosage levels. So low dosage levels would typically be in pill form. And a high dose is defined as greater than 100 morphine milligram equivalents. And so essentially, the higher the dose of the pain medication that you're taking, the more the elevated the risk for abuse is. And here you see prescription opioid painkillers are 40 times more likely to cause somebody to be addicted to heroin. The second risk factor is demographics. So simply being in a certain age group can, increase or elevate your risk and heighten your chance of misusing opioids. So typically in these younger ages or in the elderly age where certain conditions tend to appear, including cancer and other conditions. And lastly, comorbidities, which are health conditions or illnesses that tend to occur simultaneously with other conditions. And you'll notice a lot of these conditions are chronic. So COPD, asthma, sleep apnea, these are chronic conditions, and these are not acute conditions. And so chronically using, with chronic pain, chronically using medication can further your dependence on them. And there are also mental health conditions. So those with a history of depression, anxiety, and post-traumatic stress disorder are at a heightened risk for continuously using them, using opioids. And lastly, long-term use of pain relievers for those who are on chronic pain. So conditions such as arthritis, back pain, sports injuries, etc. And this graphic just depicts some of the different conditions that can predispose you as well.
Some more risk factors for adolescents, specifically in Allegheny County, include poverty and difficult living conditions. In 2018, 16.4% of people in Allegheny County lived below the federal poverty line. And for some perspective, the national average at that time was 13.1%. And poverty and lack of health insurance are socioeconomic factors that have been found to be related to the increase in opioid use disorder. Also, with the pandemic that has been going on, young people simply don't have the safe places they used to have to hang out. Most of what young adults do is hang outside, but now we're behind screens all day. And this has led to people, trying new things, including adolescents testing the waters with risky behaviors, including trying these gateway drugs or going straight to opioids.
So as mentioned before, there are many risk factors for substance use disorder, one of them being mental health, but how exactly is mental health and opioid use related? Well, half of the population of people with mental health disorders are prescribed opioids. People who have mental illnesses are 3 times as likely to misuse opioids. Many people who have substance use disorders develop mental illnesses, and around half of the population who have a mental health disorder will also experience substance use disorders. So why are people with mental health disorders more likely to misuse opioids? Well, many people who have mental illnesses are prescribed opioids for pain relief, are twice as likely to use opioids for a long period of time, may self-medicate for relief, or may have genes that make them more likely to develop an addiction to opioids.
All right, so now we're going to talk a little bit about barriers to treatment that are specific to people living in Allegheny County. So to start off, what are some examples of barriers that might exist for someone in a rural area just like Allegheny County? There are a number of cultural, geographical, and financial barriers that have led to both a lack of accessibility to care as well as a reluctance to seek healthcare in rural areas. And all of these barriers compound one another and make it difficult for people in these rural areas, such as yours, to receive the care and help and resources that people need. So, whenever we're talking about addressing substance use and misuse in adolescents, specifically in Allegheny County, it's important to note that there are a bunch of obstacles and barriers to receiving treatment that have been removed, including that telehealth is now being used more around the area, which greatly increases accessibility to care. And telehealth is basically whenever you're able to go to a healthcare appointment through your phone or your computer or another online device. Another important thing to note is that the Medicaid threshold has been lowered, which basically leads to a lot more people being able to seek care without that huge financial burden that might prevent them from receiving care in general. We're also talking about, when we're talking about improving accessibility to care, it's also important to note that there have been more bus routes added for people in Allegheny County in order to use the buses and access different care and treatment facilities. However, there are still a bunch of challenges that people in the community need to overcome in order to get to a point of being able to receive the help that they need. So first of all, due to a lack of providers and scarcity of resources, there might be waiting lists for people to receive treatment. This can range from days to weeks to months that people might not be able to get the help that they need. And then once an appointment might become available, people might not be ready to go to that appointment whenever that appointment has been made available to them. They might not be in the right space and it might not be their time to go. So that's another barrier to receiving care that people need. Another thing is that adolescents in the county have a lot more to deal with on top of these issues because there are less options for them when it comes to inpatient treatment for opioid and substance use disorders, as well as mental health disorders. There aren't those peer-to-peer groups that we see with adults, such as AA and NA meetings, which might prevent younger people especially, from going, just because if they don't have that comfortable environment, they might not be as likely to go attend those meetings, just because they don't want to speak up and don't want to be in that space with people who aren't their age. And then the other huge thing is stigma, which we'll talk about more in a second. But that can be a huge thing that prevents people from going to seek treatment, just because it's a small community, everybody there talks to one another, and everyone's connected in some way. So the social stigma of having an opioid use disorder or a substance use disorder, or having any sort of issue related to one, can be a huge topic of concern for people and can lead to this, exacerbate the stigma that already exists.
Hi, my name's Abira, and I'll be talking about the stigma related around substance abuse, but more specifically opioid abuse. So substance abuse has received stigma for decades, as mentioned, and there has been little progress made. So these stigmas can range from detaching from peers and isolation to providers refusing to seek or give care. And society in general has associated substance abuse and opioid abuse with negative stereotypes. So those who might want to get help might be self-stigmatizing themselves, and so they might not get help out of fear, as mentioned. And research has shown that stigma around substance abuse disorders is usually higher in rural areas compared to urban areas. And these higher levels can lead to a lack of support for harm reduction, as well as medication-assisted treatment programs. So social media also has a big play around stigma. It's been growing exponentially for the past decade, and it portrays a lot of inaccurate and misleading stereotypes about substance abuse. Some of the stereotypes that are portrayed usually consist of minorities that are either homeless or live in low socioeconomic households. But in reality, it's been shown that white men of higher socioeconomic status are equally, if not more likely, to suffer from opioid abuse and substance abuse. And this is because opioid abuse tends to come from when patients are given these pain meds for post-surgery pain relief, and slowly they start to become addicted.
Okay, so now we're going to talk about some of the education and resource options whenever you're trying to look for more on substance abuse, opioid misuse, and related topics. So first, to start off, obviously there is CORA, which is our organization. CORA stands for Combating Overdoses in Rural Areas. So this is an organization that is focused on helping uplift people in rural communities, specifically similar to Allegheny County. Our chapter at the University of Maryland focuses on communities in Maryland specifically. We have teams that are focusing on different counties, but like I mentioned, our team focuses specifically on Allegheny County. There's also the Rural Community Toolbox, which was created with a bucket load of resources that are all online. And you can visit the link to see what they have in store. Another big one that is more locally run is Prescribe Change Allegheny County, which you guys might have heard of. This is run by the Allegheny County Health Department Behavioral Health Unit. And this was actually a source that we used for a lot of the information that we presented today. And we encourage you to use it if you're looking for more local resources of where to go for specific things or more specific statistics related to your county. If you're an adolescent or a teen or a young adult watching this, then we recommend going to this teens.drugabuse.gov. This specific link that we've provided gives you facts that are easy to understand whenever you're looking at things like prescription drugs and opioid abuse, but they also have other information on it that's pretty useful. We kind of brought this up earlier, but there are virtual Narcotics Anonymous meetings that they're, like it says, doing virtually due to the pandemic. I think they've done them in person in the past, but for the moment they're doing them virtually. And this isn't just specific to Allegheny County. And then finally, the last one that we have on this slide right here is SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They operate a national helpline, which you can call if you're in need of help. And then they also have a website that has a lot of good information and resources on it. And now we have some more local resources. In addition to Prescribe Change Allegheny County, which I mentioned before, there's the Allegheny County Health Department Behavioral Health Services Department. We met with one of the individuals who runs the unit, and she was extremely helpful, and we recommend contacting them or going in person if you are looking for more information or looking to make more of a local change in your area. There's also the local Behavioral Health Authority office. There are medication disposal bins that are located across the county. Some locations you can see on this little graphic on the left include the sheriff's office, the Cumberland City Police Department, the State Police Barracks, the Frostburg City Police Department, and then the FSU Police. These are operated for the most part. Some of them are all day, others have specific hours and throughout the week. But there are green bins where you can dispose of your prescription medications or over-the-counter medications that you're looking to get rid of so that you can prevent an opioid overdose or any instances of potential opioid misuse or abuse in your household. And if you're a parent of a young adult or adolescent, there's this toolkit that Prescribe Change Allegheny County has made on how to talk to your kids about drug and alcohol abuse. And you don't have to talk to them if something is going on. You can talk to them to prevent it or to let them know how to address it if they're seeing it in their peers. But we definitely recommend checking out these resources. This is where we would have done a group activity, but for now we're going to move on. These are some flyers that our team worked on throughout the semester. On the left, we have one on how to deal with storing medications. Like I mentioned in the last slide, There are things like drug take back programs, and there are those green disposal bins throughout the county where you can safely dispose of your medications. We also recommend that you store them properly and out of reach of children or other people in the household that don't need access to them. And then on the right, we have a flyer that was more targeted towards adolescents or people just who don't have a background when it comes to learning about opioids. And it just provides basic information, which you can read through on your own time. We all just wanted to say thank you for attending our educational module. We hope you learned a lot and were able to take away some good information and resources that you can now use in your communities and with the people that you interact with. And yeah, thank you.